Did you know that if you're a person with an intellectual or developmental disability, that your lifespan is less than those without disabilities? That you have a higher incidence of arthritis, of diabetes, of heart attacks, of strokes, of chronic obstructive pulmonary disease, and depression? That you're more likely to be obese? That if you're a woman who becomes pregnant, that you're more likely to have a high-risk pregnancy and complications? The National Council on Disability in February of 2022 released a document called Health Equity Framework for People with Disabilities. It's a very important document that details a number of factors, a number of things that need to be put into place to help resolve many of these issues that I just mentioned. There are four key components to this document, four paramount policy issues, as they call it. The first one is designating people with disabilities as a special medically underserved population. This is really important because this opens up doors for research, and for funding and for other avenues that can help resolve many of these health issues. The second component is requiring comprehensive disability clinical care curricula in all U.S. medical schools, nursing schools, and other health professional schools. I'm going to come back to that one in a second. The other two are requiring the use of accessible medical diagnostic equipment, meaning that so that any person can, say, get a mammogram or get onto an exam table, regardless of their level of physical abilities. And also improving data collection concerning health for people with disabilities across the lifespan, because we know that data informs policy. But going back to number two, requiring comprehensive disability clinical care curricula in all U.S. medical, nursing schools, and other health professional schools. That is something that is of paramount importance, something that I realized so early on in my career that I was lacking when I began practicing in this field. And over the years, I've learned a tremendous amount, and it's really become my passion to try to improve health education for clinicians so that they understand how to provide basic, competent health care for people with intellectual and developmental disabilities. These are things that are not widely taught in most health professional schools. I've worked on a program to create this, both in the state of Mississippi, where I used to practice, as well as an online course called the Curriculum in IDD Healthcare that's specifically geared to teach healthcare providers about this. In fact, our entire company's mission is to provide tools and training to people who support those with intellectual and developmental disabilities and other vulnerabilities. I can't stress enough the importance of this to help remove the disparities, the health disparities, and create health equity for all people, regardless of any level of disability. I encourage you to look more into this. Look at the National Council on Disabilities site and look at the framework that was published. And also you can visit our website at replacingrisk.com to learn more about tools and training that are available to you.